without knowing what the we can't solve the problem without knowing what the problem is. So before treatment we have to diagnose the problem. So diagnosis is much more important to begin the treatment. Okay, let's start with the traditional diagnostic methods. First, we have to take complete assessment of behavioral history and developmental history of the child. These assessment usually conducted by specialized healthcare providers like pediatrist, neuropsychologist, and psychiatrist also. In this, some of the diagnostic tools are used like CORS, Childhood Autism Rating Scale, and ADOS, Autism Diagnostic Observation Scale, and ADI, Autism Diagnostic Interview, like communication lag and repetitive behavioral issues are noticed by these scales. Not only this, the therapist observes some things like cognitive skills and perform developmental skills. So what, how they develop? So to diagnose any other problems, any other neurodevelopmental problem are there in the child. So to diagnose this, the therapist doing many more process. But these traditional methods are not accurate. So accurately every therapist has accurate values, but nowadays the diagnostic methods are updating, and in this their accuracy is similar, like 0 point that like so similar. Okay, in this video we are going to discuss about the latest tools like genetic testing, neuroimaging, what are all the early screening tools for ASD. So these are all we are going to discuss. First, genetic testing. We in our last video we just discussed some causes of the ASD. So in this many more genes we discussed like ZANG3 like this. So these problems, disorder, Fragile X syndrome. So these are all caused by a single gene, and a multi-genetic factor also have involved. So to diagnose the genetic problems, we have to do the genetic testing. So the DNA of the person is taken and the gene variants are read. So then the genetic variants are observed by the therapist and they diagnose the ASD. So these diagnostic techniques is not only for the understanding purpose, so to target intervention. So we have to focus on the target of the person. So genetic variation is the problem. Then we have to focus on the genetic variation. So we have to intervene in a targeted area. So for this purpose, diagnosis is helpful. Then neuroimaging. The structure and function of the brain is read by the scientist and they furtherly develop something in the brain. So like the scientists use some of the neuroimaging techniques like fMRI, functional magnetic resonance and imaging, and SMRI, structural magnetic resonance and imaging. In this they focus the pattern of brain activity during a particular task. In this task, how the brain is acting in a which pattern, like they diagnose. Then DTI, diffusion tensor imaging. So this is helpful for the connection of the white matters of the brain. So how the connection are better or not better in the brain. So these are all treated by this DTI, diffusion tensor imaging. Then PET, positron emission tomography. It is useful for the particular chemical action. So some of the chemical action happening in our brain. So particularly which chemical is going the action in this brain. So these are all noticed in the positron emission tomography. And recently developed some early screening methods. So in 10 children, we have to screen these children have a ASD or not. So in 10 members, 10 normal people, we have to diagnose 1 or 2 persons. So we have to select the person of the ASD by using the screening methods. So in nowadays AI is developing. By using the AI, we can screen the child of the ASD. In this, the AI are trained to analyze the behavior of the child. So in how the training happens, by the videos of the child are given to the AI, and by the past child videos are given to the AI, and these like symptoms are studied, and the AI going to analyze and screen the child of the ASD in a normal group. And eye movement pattern, social scenes. So these are all also included by the AI. Okay, in our video we just discussed what are the diagnostic methods of the ASD and what are the advancements. In next video we are going to discuss what are the treatment approaches for the ASD and what are all the advances. So keep watching, keep waiting for our next video. I think this video will motivate and give some information to you. I know. Kindly subscribe and support for our further videos.